review the state of the pandemic and also learn from each other. So after that session and after a serious discussion and review of the evidence that were reported, Africa CDC concluded that the benefits accruing from the AstraZeneca vaccines continue to outweigh any risk possible. And accordingly, we recommend the following to member states. And our statement is probably out now or will be out in French and English in the coming hours. First of all, the EU member states are recommended to continue to use and roll out the AstraZeneca vaccine as part of their vaccination campaign. And the EU member states that as they do this, continue to ensure that there's routine monitoring, reporting, and evaluation of adverse events following immunization, what is commonly abbreviated as AEFI during the immunization. And that any policy decisions pertaining to the vaccination rollout should be based on evidence and thorough regulatory review processes and not based on anything that is subjective. And that Africa CDC will continue to monitor the adverse events following immunization with all the vaccines and not just the AstraZeneca vaccine, and provide evidence-based recommendations as the situation evolves. And just to say that a lot of the measures that were imposed in Europe are really, first of all, temporary measures, precautionary measures, and some countries, again, as you all know, in Europe and North America, like Canada and the UK, continue to use the vaccine or are recommending that the vaccine should be used. And they have immunized really millions of people using this vaccine. So let me end here and turn it back to you.
Thank you very much. That was Dr. John, the director of the Africa CDC. And indeed, we do share in the sadness of the people of Tanzania over the passing of His Excellency President John Magufuli. Let me now call upon Dr. Merawi, if he's with us, to give his update on the situation in the DRC and in Guinea with regards to the Ebola outbreaks. Good morning, Dr. Merawi, and please, you can go ahead with your brief.
Good morning. Thank you, Madam Winnie. I will just give you a brief highlight on epidemiology situation and the risk of spread of Ebola virus disease across the region and what measures that need to be taken. So in general, as of today, in these two countries, DRC and Guinea, a total of 30 Ebola cases have been reported, with a total of 15 deaths with case fatality rate of 50%. And 11 people have already recovered. In the DRC specifically, since the last briefing, one new probable case and one new death and 2 recoveries have been reported in North Kivu. The last confirmed case was reported on the 2nd March 2021, which is around 16 days, consecutive days without confirmed case. Cumulatively, 11 confirmed and 1 probable case with 6 days have been reported, and of these 11 cases, 2 are healthcare workers. And generally, in DR Congo, a total of 279 contacts listed and 230, which is around 86% of the contacts are under follow-up. Since the very beginning, a total of 1,566 people have been vaccinated in the affected health zones. Among these, 177 are frontline workers. In the Republic of Guinea, since the last brief, no new case on days reported. However, 3 new recoveries have been reported in Zerekore. And the last confirmed case was on the 4th of March, which is around 14 consecutive days without confirmed case. Cumulatively, 18 cases with 9 deaths with 50% case fatality rate and have been reported, and 5 of the cases were healthcare workers. And 7 people are recovered in Guinea, 1 from Conakry, and 6 from Nzero. In general, the response in Guinea looks like 326 contacts listed, and 96% of them are under follow-up and monitoring. Of the total 679 contacts, 78% have been already vaccinated. Since the beginning of this outbreak, a total of 3,352 people have been vaccinated. Of these, 1,775 are frontline workers. Today, I wish to flag what the risk assessment revealed and the risk of spread of the disease across the region, and both the West and Central Africa region. From the assessments conducted by Africa CDC in conjunction with other partners and with local context, in context to the local context and regional context, the risk of spread of the outbreak is high in both regions. These contributing factors mainly include incomplete follow-up, as they reported. Almost 86% are under follow-up in DR Congo. So we need to have like 100% follow-up for contacts. So incomplete follow-up and contact tracing, high cross-border population movement in the region. And there is a community resistance with regard to infection prevention measures, safe and dignified burial, vaccination, and alert reporting. All these add up into community resistance and risk for potential spread, especially in North Kivu. Insecurity and hard to reach areas are there, which also another risk. With ongoing multiple disease outbreak competing for resources in Guinea, which is like including COVID-19, yellow fever, poliomyelitis, measles, these all are contributing factors for the high potential risk of spread of the disease. As previously mentioned, Africa CDC senior leadership visited 4 member states and assessed and agreed with the top leadership in health in these countries on the key areas of support for strengthening response activities in the affected areas and preparedness for neighboring countries. This includes cross-border collaboration in surveillance, information sharing, capacity building in laboratory, surveillance, community engagement, infection prevention and control, and community mobilization and risk communication, and technical support with deployment of rapid response team, as well as community health workers. The Africa CDC is working on in these areas to support member states. We are mobilizing IPC materials to be shipped, hopefully by next week, to these countries, as well as a deployment of community health workers in these affected areas and technical experts. Thank you very much. Back to you, Madam.
Thank you very much, Dr. Merawi. We move straight into our question and answer session, and these questions are going to Dr. John, these first ones. Dr. John, the first 3 questions are talking about the same thing, but I'm going to bunch 2 of them together because they are very similar, and then come to the third one, which is also still on the same issue. So the first person to write in is Rumbi Chakamba, and Rumbi says she is a reporter with DEVEX. She says, I wanted to ask Dr. Nkengasong if he thinks that the move by European countries to temporarily suspend the use of AstraZeneca and the questions surrounding its efficacy on variants will increase vaccine hesitancy in the countries that are rolling out this vaccine. Then she asks, if so, what is being done about this? Now, let me combine that with this question that is coming from Rodney Muhumuza of the Associated Press. He says, would the director please comment on how safety concerns in some European countries regarding the AstraZeneca vaccine are impacting on public confidence in Africa, despite his update right now, especially given that this particular shot is the only one that is currently available in many African countries. Then he asks the question, what else can health officials and/or governments do to discourage the growing vaccine skepticism in light of the developments in Europe? So that is almost the same question, but posed from different angles by the two colleagues.
So thank you, Wayne. The question from our colleagues from Denver about the effect on variant on the AstraZeneca vaccine and the situation in Europe, what we have observed over the last week, it will clearly not be helpful for our public confidence, in building public confidence and trust on the use of that particular vaccine and other vaccines. The whole area of vaccines has been a very sensitive area that we at Africa CDC, as you are aware, had been very early on anticipated these problems and started doing studies, behavioral studies, to understand the magnitude of the problem and how to solve them. So you're right that these are unfortunate events, but they are not unusual events. In other words, when you're dealing with a pandemic, a new disease, you expect that your behavior, human behavior will vary, and it will continue to work with the community and different levels of society to address this. We saw this in the HIV pandemic. We saw this in the Ebola situation. When vaccines were first introduced for Ebola, it wasn't obvious that the communities were going to receive them. And even it was shown that the vaccines were very effective in West Africa, and during the Ebola outbreak in Mbandaka, just a few years down the road, it was still problematic for use of those vaccines. So clearly, the variant situation and the situation we are seeing in Europe now with respect to behavior of countries is not going to help the situation. Now, with respect to building confidence, I mean, that is work that it has to be continuous, and it is all of our work and efforts that we should work concertedly to make sure that the right message is shared, that the right information is shared, and that the right education, what I call vaccine literacy, is actually promoted. And if we do this collectively and using our respective networks and champions and championships, I'd have no doubt that we will overcome it. We cannot undermine this challenge. The whole premise of good public health practice is based on trust, building trust with the community, building trust with public health agencies like Africa CDC, Ministries of Health, and WHO. And so my request to all of us will be that let's join forces to share the right information. The right information is that these vaccines are safe. The right information is that we have used vaccines all over the years, and the reason some of us, including me, that are alive is because we've received more than 10 different kinds of vaccines, including measles, tetanus, and all kinds of vaccines that are out there. And that this is not, the COVID-19 is not, it does not present an exceptional challenge. It represents a normal vaccines and protocols that are done. Now, the situation in Europe is interesting because it shows us that they have good surveillance systems in place, which is monitoring, they are monitoring the process very, very well. So I liken that to a scenario where you have good systems to prevent a situation, and then when a situation doesn't happen, then you get you get alarmed with that. I think what I'm saying is that if they didn't have surveillance systems to be tracking what is going on, it would be a disaster. Now they have it, they're picking some events, and they're still investigating if these events are truly linked to the vaccine. I think that should rather be recognized as such, as good public health practice, and not be used against the vaccine. As I said in the briefing, we, Africa CDC, are recommending that African countries should, but we strengthen.
That was released recently. So she's asking if you think that it is still a true reflection of perceptions on the continent, given that there has been other information that has come in to throw perhaps some doubt on that information.
That is an excellent question. The vaccine perception survey is a cross-sectional analysis. It's a snapshot of what was happening on the continent at that time. And you have to assume that the situation will either move in a positive direction or move in the negative direction. That is what, so it was a static analysis that was done, and we need to continue to monitor the situation over time, and especially as people receive vaccines. So my prediction is as follows, that you see an initial hesitancy to receive the vaccines, but as many people are immunized, as we are seeing in Rwanda, and no one is falling sick, people falling sick because of the vaccine, people will recognize that the vaccines are helpful, and then it will increase the confidence level in that. I think we just have to be patient, consistent with our messaging, and of course recognize that what you said is valid, that we need to repeat these surveys over and over, especially as vaccination rolls out. Let me just repeat what others have said before that. As we know today, the world has suffered from the loss of about 2.6 million deaths because of COVID. And no one has died because of receiving a vaccine, a COVID vaccine. I think let's put that in the right context.
All right, thank you. Let's say good morning to Girum Chala. Girum, good morning.
Good morning, Madam Wei.
Morning, Girum. Please go ahead with your question.
Thank you. Thank you so much, Dr. John. As usual, we are so much happy, and we respect your input all the time. And you are perhaps one of the most consistent African Union officials that we know when it comes to delivering information to the media and the people of the continent. So I thank you so much, really, for making our jobs much more easier and helping us help you at the same time, by the way. Just want to say that first. The first question I have is on travels. You have been announcing on your website about a possible agreement with Ethiopian Airlines to make flights or travel safe amid this pandemic. And what is really the details of that agreement with Ethiopian Airlines? But in general terms, I want to understand, what do you think is going to be the future of traveling across the continent or across the world now that people are actually thinking of vaccination approvals, or being vaccinated becoming a new trend or a contribution for a person to travel safer than before? So what's really your impression on this?
So thank you, Giram, for first of all, for the kind words, and we take it as Africa CDC to our hearts. And your presence here, you, the media, your presence every Thursday on this platform makes it worthwhile. We know that we are not only talking to you, but we hope that the partnership with you is a partnership with the continent. I think we have to have that partnership with our people, our 1.2 billion people on the continent, and there's no other way that we can do that without you working closely with you. And we take it very seriously, and we have said all along that we will give you the information the way it is. And when we don't know it, we'll tell you we don't know. And this is a fast-moving pandemic, and the information almost changes on a weekly basis. I think I would do our best to keep you updated. You raised two critical issues, Jerome, which are extremely important with respect to and linked to the economy, because this pandemic is not just a health issue, it's an economic issue, it's a security issue. But let me dwell on the economic issue. First of all, in October, if you recall, we launched an initiative called a campaign called Africa Against COVID-19, saving lives, saving economies and schools. And as part of that campaign, a subset of that campaign was to launch what we call a trusted travel, where we made a case that as a continent and as a part of our integration, we should be able to travel more easily, not freely, but easily, which means that if I do a test in Cameroon, the test should be recognized by Ethiopia and recognized all the way to Liberia or to Libya. And so we started that, and we have created a platform called Africa's CDC Trusted Travel, and which was really a brilliant collaboration between the public sector, being Africa CDC and the AU, because there have been like 4 commissioners were there when we launched it. It really showed a partnership across the AU, but also partnership with the private sector, because we work with a panel BAOS, which is headed by Dr. Edem from Ghana and EcoNet. And we have since mobilizing other technologies to build the platform so that you can actually just do your test, upload the results into that platform, and then when you get to the airport in country X, they see that and recognize the test. So it ensures for a trust, which is validity, as the name says, a trusted travel, but it also begins to take off counterfeit testing. So that is what you are seeing with Ethiopian Airlines. Kenya Airlines have already started doing that. Rwanda have started doing that. And that we as you saw in the announcement yesterday, Ethiopian Airlines has come on board, and we really hope to roll that out across the continent. As you and I know, travel has just become complicated. Gone are the days where you wake up in the morning, you buy your ticket, and you're off to South Africa, or you're off to Ethiopia. I think you will require that you first check your test. You do the test, and the test is valid within a certain timeline. And that is what we are trying to do, to facilitate you all so that you can move relatively easily across the continent in a more standardized way, but in a trusted way, because it is our responsibility, all of us, to make sure that you do not transport infections from one country to another. The second thing on vaccines is that you see that the world, especially the developed world, is moving towards imposing a vaccination certificate, which says that you have to show evidence that you have been immunized by one of the recognized vaccines in order to travel. Some airlines, including the British Airways, and I think Qantas in Australia, are already very, very loud in this. And I believe tomorrow also, the European Union Commission and the AU Commission, led by Commissioner Amani, will be having a workshop, which I will participate with our European colleagues, to begin to have a dialogue on that and express some of our concerns. What are our concerns? Our concerns are that we are not opposed to an immunization certificate, but we are saying that you have to have a level playing field before you impose that. If we do not even have vaccines on the continent and to go get ourselves immunized, then you ask that we should show a vaccination certificate to travel, then you are creating the inequalities and inequities that have all been really exposed due to this pandemic. And we don't want further of these inequalities and iniquities to be further exacerbated because of the lack of vaccines and then the imposition of a vaccine in order to travel. So that is what is going on. We will also in the coming weeks be, as Africa, be consulting ourselves to look at how do we put systems in place that will enable anyone who has been vaccinated to be captured properly, so that when you are traveling, your records are already all over, so that they make it easy for you to travel. I'm sorry, I was a bit long there, but I think those are two very important initiatives that we are working on as the African Union, and it squares nicely into our integration agenda.
Thank you very much, John. Now, the next question is for Dr. Merawi, and it is coming from Paul Adepoju with The Lancet. And Paul says, Dr. Merawi, considering that the case fatality rate for the current Ebola outbreaks are similar to previous ones, I'd like to know what specific impact the new Ebola drugs have had and that they have made in this present outbreak. Then he has a second question. Also, what gaps still exist towards ending Ebola outbreaks in Africa?
Thank you very much. That is a very, very important questions. The first one is, I think it is too early to conclude as such with this existing data about the specific impact of the existing currently rolled out drugs and therapeutics and vaccine. So far, yes, monoclonal antibodies are rolled out in that area. Treatments facilities are set up, and yet are not to the level of well equipped and still in progress in development. But it is really too early to conclude saying that there is no impact at all, or there is a high impact or so. So this is too early on that area. The current gaps existing currently is, as I said, the main challenge now is community resistance. I think there is community resistance in all areas of intervention, including infection prevention, safe and dignified burial practices, and alert notification. And the alert notification is there is some alert notification even in neighboring countries, but are not yet to the level that we wish to have. You know, we need to have a lot of alerts. Then we screen from there, identify some suspects, and trim down into laboratory for further confirmation of the test. But it was unfortunate that there is no such a huge number of alerts that are coming into the picture. So the main gap is really, I wish also the media to address this, is we need to give the right information, risk communication, community engagement areas on those areas. With regard to healthcare preparedness and therapeutics, treatment facilities, and so on, there is a resource limitation, still challenging because of multiple disease outbreaks and ongoing COVID in both DRC and North Kivu. And you can see also there is some kind of fund gap with limitation to address as we wish. So these gaps, including both technical as well as financial, which are really cross-cutting, including workforce, that we are really trying to fill in as Africa CDC, are the main challenges and gaps. Thank you.
Thank you, Dr. Merawi. I'm staying with you because the next question is also on the Ebola outbreaks. And this one is coming from Sarah Jerving, and she's with DEVEX. Now, Sarah says, can you talk a bit more about why there is community resistance in the Ebola outbreaks? And is it happening in both countries? Then finally, she says, what is preventing 100% follow-up of the contacts?
Thank you, Sarah, for those important questions. The first question, why there is community resistance so far, is I think this is more of socio-cultural thing that we are really working on to get more anthropological study on that area, on those areas, both in DRC and Guinea. But also there is also some priorities and issues with the community that we need to address. Specifically when it comes to North Kivu, you see there is ongoing decades-long conflict that is really very stressing for the community to engage into something specific on this area. So I think this really directly links to the second contacts and follow-up. It's not 100%. It is good, like we reached to 96% in Guinea, but it's not 100% in DR Congo because of this hard to reach area. There is some civil strife there that we can't. The community health workers and epidemiologists are not able to reach to. And some are really hard to reach geographically, very inaccessible areas. So because of this, it is turning to be very difficult to reach out and to get more alerts to engage more communities. But we wish we'll be there every day. There is improvement from last week, this week, there is improvement. And we'll try to reach to the 100% and address the community resistance. Community resistance needs really a continuous information feed, continuous education, a continuous, it's not like a one shot that we can address, but it is really coming. We are trying to reach that with the local health, community health workers who are like identified, who have them some degree of trust by the communities themselves, so that they can teach among each other. I think that is the way that we are moving. That's why we are really planning to deploy massively on that area, and especially in community health workers. Thank you.
Thank you very much for that. And now we move back to Dr. John, because we have a question from Paul Adepoju. And Paul says, Dr. John, I'd like to ask you if there is any update regarding the indemnification legal issues surrounding the doses that the African Union is getting from South Africa. Then secondly, he says, I also want to know your view on how intra-African health inequality contributes to poor disease outcomes on the continent. So those are two questions coming from Paul Adepoju of The Lancet.
Yeah, good morning, Paul. And Paul is very good at asking very difficult questions. And I think I'll do my best. With respect to the first question, Paul, there are absolutely no legal issues with the vaccine from that we acquired from South Africa. Absolutely none. It has been delayed because of a series of things that myself I'm learning how this whole processes work. So if you recall, the vaccines came from the Serum Institute and to South Africa. And when South Africa noticed that the vaccines had an issue with the variant, then they turned to the AVAC, the African Vaccine Acquisition Task Team, which we strongly recommend, and we are part of that. But then it requires certain legal processes. I mean, South Africa doesn't just take the vaccines and give to AVAC. You need lawyers to come in and work on agreement. And then you also need to work with the Serum Institute to get their own lawyers to work with South Africa to transfer those indemnities and insurances from South Africa to the AVAC. So all of those, you may seem like you could do it in a day, but in the legal world, it takes their own world to get things done and done properly. So that is what has delayed. But as we speak, the distribution of that vaccine have started already. I think Malawi got its vaccines already. And then we have a large shipment going to West Africa, the West African route today. I think today and over the weekend. So I think a series of countries in that trajectory will be receiving their vaccines. So that issue is over. With respect to intra-Africa inequalities, that is perhaps why I always say that the creation of Africa CDC was one, in my view, one of the greatest vision and wisdom of our head of states, because it was created really to ensure that there was greater to improve inequalities and inequities amongst African member states and enable them and build their capacities and capabilities to respond to disease outcomes, and including non-communicable diseases, emerging infectious diseases like Ebola, COVID, and then, of course, the endemic diseases like HIV, TB, and malaria. So I think we continue. The world is what it is. It is not what it's supposed to be. So, but having these structures like the Africa CDC, we hope it offers hope for the continent that you can actually begin to narrow those inequalities and inequities.
Thank you very much. We stay with you. And the next question is coming from Judith Akolo. And Judith is a journalist with the Kenya Broadcasting Corporation in Nairobi. She says, Dr. John, last week you said that the rallying point is to ensure that everyone is safe. How far is the Africa CDC working with Tanzania, our neighbors, to contain COVID-19 now that there are no statistics coming out of that country?
Thank you, Judith. I hear you, and as I said last week, no country in Africa is safe if there's a COVID threat in another country. We have been very open with this, that the statistics we got from Tanzania stored last year, around 509 cases, and we have not had any further statistics. We have been using all kinds of channels to continue to impress on Tanzania to open up and reach out to us so that we can provide the necessary support. You also heard a few weeks ago that there was a perceived change in behavior towards recognizing that COVID was in Tanzania, and we remain very, very optimistic that we will continue to work with them to address the issues of COVID in that country and offer them support and rally partners to bring COVID-19 in that country to the right, ensure that they use the right measures, public health measures to address the COVID-19 challenge. But as you can recognize, it's a tough engagement. If the political leadership doesn't recognize a disease, it becomes very, very difficult. And I think the highest level of the AU has been engaged using very different channels to make sure that Tanzania rallies in the spirit of our continental strategy to cooperate with us and coordinate their efforts with Africa CDC, the World Health Organization, and others.
All right, let's say welcome to Esther Nakazi. And Esther is a freelance science reporter. And Esther, you have your hand up. Please go ahead with your question.
Thank you, Winnie, and thank you, Dr. John and Dr. Melawi. My first question goes to Dr. Melawi. Given what we know about the Guinea situation on Ebola, that a man who survived with Ebola for 5 years is the cause of the current episode in Guinea. What are your thoughts about that, and how does that inform public health messaging, and what should we do differently in Africa now that we know that, this virus survives in the body for 5 years and it can trigger an epidemic as such? And then to Dr. John, is there any country in Africa where the private sector is playing a role in the rollout of COVID-19 vaccines? Thank you.
All right, Dr. Merawi.
Okay, thank you, Esther, for your question. With regard to the source of infection for Guinea is still under investigation. I think the first case was a nurse that passed away in January 2028. So that was then we were tracking backward with some review of registries and so on. So, but the fact is this virus can be shared from immune-protected regions like reproductive organs, like gonads, for longer period, more than months. So the message, I think this one is the Guinea is still there under investigation. We'll get back to you when really concrete information data is available. But the fact that such virus can stay longer in the reproductive organs and can be shared for months, 9 months, 10 months, indicates that we need to follow up those survivors for a prolonged period of time with frequent serum analysis, for the virus, and continue to do protective measures, including provision of condom when they are discharged. There is a protocol that we usually follow to when discharged and advise support, psychological support on their spouse or partners to take care of each other. I think that is a message that we need to pass for the public to learn. This is really more educational that we need to address consistently. Thank you.
Thank you very much, Dr. John. There was a question for you.
No, absolutely. A very excellent question. We have stated clearly that as a continent, we are going to be facing an unprecedented situation with respect to the rollout of the vaccines to reach our target. And again, let me say this very clearly. We are aiming as a continent to vaccinate at least, I want to underline that word, 60% of our population in the next 2 years in order to have a fighting chance to get this pandemic out of the continent. And that will require an unprecedented scenarios, and where we'd have to think outside of the box and not only rely on the public health systems in the countries to roll out the vaccination. So at that point, the private sector is highly welcome and encouraged and strongly encouraged to partner with the public sector to facilitate the vaccination exercise in any country. So I think all hands on deck. We have to be committed to the process. And if we do it together with the private sector and public sector, then we have a good chance that we might be reaching our target by the end of 2022. And then 2023, we begin to actually strive to live a normal life. So private sector is definitely welcome to join these efforts.
All right, thank you. The next two questions are for you as well. And they're coming from Lawrence Caramel. So Lawrence says, can you give us more details about the situation in Kenya, where the situation is worsening? Does this mean that a third wave is taking place? But he has another question, and he says, when will you publish the list of countries that will receive the 270 million doses secured by the African Union? Is there any difficulty in terms of finalizing the deals between countries and companies? So those are questions from Lawrence of Le Monde.
No, you're absolutely right. Kenya has done exceptionally well in bending the curve twice. The middle of last year is stabilization. And when it stabilizes, they can only come back up. Okay, so we should be actually anticipating that in the next 2 months or so, as a continent, we'll be approaching the third wave if vaccines are not introduced. Again, that is the core reasons why we need to have vaccines introduced on the continent as soon as possible, so that we get rid of these waves of a wave coming up. We lock down our economies. It's very damaging to the economies. Of course, it's very damaging to our health systems and health itself. Second question with the deals is that, I mean, as I explained earlier, I mean, we don't have any difficulties with the deals. It's always the negotiations with the lawyers and with the companies, and we will be happy to put out a list as soon as possible. We have it's supposed to be very open information, but there's absolutely no value in bringing information to you that is not finalized and concrete. Otherwise, we confuse our own citizens, and which is what we really don't want to. So, for example, if last week I said, oh, country X has placed an order of this, and then they change their orders because they want more Johnson & Johnson doses versus AstraZeneca. It just creates confusion, in which we as a public health agency, we really don't want to encourage that. So it's not because we don't want to, but it's just that we want to be sure that when we bring it to you, we bring in you a very clean information.
All right, let's take this question now from Christine Palitza. And Christine is with the German news agency. She says, are all African countries advised to vaccinate health workers first, followed by essential workers, then people with comorbidities, etc.? Or can each country set up their own schedule? Is there flexibility within the schedules depending on the needs arising in a country? And finally, how much flexibility is advised in terms of handling the vaccination campaigns?
So this is a series of very important questions. I mean, we have said as well as other public health agencies, including the World Health Organization, that you can prioritize those three categories of people because of the limited access to vaccines, i.e., healthcare workers, because they are the ones receiving patients and managing patients in the hospital. You don't want them to be infected and go back to their families. Those with underlying diseases, because you want to decrease to fall sick and die. And of course, lastly, the elderly people that can be more vulnerable to this virus. So having said that, public health is local. And public health is policy and politics. I think we have produced guidelines. The World Health Organization has produced guidelines. It is up to the countries to take those guidelines and customize them to their needs. To meet some countries will consider security forces as a priority group to immunize. That is up to the country to do that based on availability of vaccines. And if they've gone through the first category of people and they feel comfortable, then you establish a criteria, an objective criteria on how to roll the vaccines out, while maintaining the whole concept of really be accessible to those who need the vaccines, and progressively as the vaccines become available, you expand it to the general population. I think that is our guidance to all our member states.
Thank you very much to both Dr. John and Dr. Merawi. It's time now for our summaries. And let me start with Dr. Merawi. If you can please, in a minute or two, just summarize the key points that you want the media to take away in terms of the Ebola response from this press conference.
Thank you, Madam Winnie. Thank you, colleagues. I think my main message for today is, as I said, there is a risk of regional spread, potential regional spread, and there is a high community resistance. So as we are working on to build the local capacity and regional preparedness, I wish the media to really address the community engagement, risk communication, and passing the message on the facts about Ebola and Ebola virus disease in those countries and communities. I think that is the main message that I wish to pass: community engagement, risk communication, and telling the facts for the community. Thank you.
Thank you very much, Dr. Merawi. Dr. John, your final comments for today.
My final comments today is really, again, let me end where I started. My sincere condolence to the people of Tanzania. We are with them in our thoughts and prayers. In the area of public health, I really want to leave all of you with two messages: that we are recommending, as Africa CDC, that the AstraZeneca vaccine will continue to be used. Those countries that have stored it, we strongly urge them to reconsider their situation and use it, because the race is not on our side. Actually, as someone rightly said here, our country is moving towards the third wave. Yes, it's very possible that in the next 2 months or so, we'll see
Dr. John, I wonder if you can still hear us.
I can still hear you.
All right, please proceed with your summary.
Yeah, that I was just saying that quoting some statistics. I don't know if you heard me about the 850,000 doses, and then the 1,100 that have been randomly checked, individuals who have received the vaccine but with no serious effects. So that is very, very reassuring. But I just want to guarantee our population on the continent that you can count on Africa CDC and other partners, including the WHO, that are watching the situation very, very closely.
All right. Thank you very, very much to both Dr. John Nkengasong, the director of the Africa CDC, and to Dr. Merawi, who is in charge of the incident management regarding Ebola within the Africa CDC. Thank you very much to colleagues who've joined us. Thank you to the African Union and Africa CDC teams that are constantly working behind the scenes to make this press briefing possible. To all colleagues, let us meet again next week at the same time, and that is 11 a.m.